the screening test that normally doctor will use or clinical psychologist will use. Okay, the first one, the first level of screening is modified checklist for autism in totalist, which also known as MCHAT. Okay, so it's actually 23 item of questionnaire. Okay, parents will answer this question. Okay, this is for age 18 to 24 months of age. And this questionnaire has been translated in Malay and Chinese language. So it has been widely used in clinics, in KK, if they suspect that the child showing symptoms of autism. Okay, the next one is actually Gillian Autism Rating Scale. So this is more like the second layer of diagnosing a child with the autism. So the second tier. So it has 42 questionnaire. So this is for children aged 3 to 22 years of age. Because sometimes, because we are not exposed about all this autism, ADHD, we only know that our child is not really like other siblings. So, but you don't know what is it. But it becomes apparent and the problem becomes sustained until they reach this adolescent period. Okay, so we can use this assessment to actually identify whether this child is actually have autism or not. With diagnosis, sometimes people at the age of 24, then only they come and say something is not right, even since my childhood, but I don't know what. And after we dig and ask few histories and things like that, so it happens that they actually have autism undiagnosed. Okay. So the items are grouped into 3 subtests. So we are looking at the stereotype behavior, communication, and also social interaction. Okay, childhood autism rating scale. This is it. We choose either one, like I choose cars or GARS, okay, to actually see whether someone has autism or not. So this is actually 15 rating scale used to identify children with autism. So basically, there are, if I'm not mistaken, 15 areas in this questionnaire. 15 questions. They ask about the severity of each component. So from there, you can see after completed the question, then you can see whether it actually fall under mild, moderate, or severe autism, the level of severity. Okay. There's also Asperger syndrome diagnostic scale. So this is basically a 50 question, yes or no item for 5 to 18 years old. So Asperger, because autism is a spectrum, so there's mild, moderate, severe, but there's also like high functioning autism. They don't have difficulty in speaking, so they can communicate. It's just that their communication is not the same like how people talk. They can talk, but usually they will talk about specific topic that they like, and it's difficult to interrupt when they talk or change the topic or the subject of the conversation. And they have difficulty to understand when people being sarcastic, you know, like the social communication part, the underlying meaning of the intonation of your voice, the facial expression, and things like that. So it's quite tricky to diagnose someone with autism, Asperger, because they can be very smart in certain areas, but after communicating with them, then you can see that it's not like the way you communicate with other people.